We at McLean are very proud of our Deconstructing Stigma Storytelling Initiative, an international public awareness campaign highlighting honest, first person stories about the mental health challenges faced by people all around the world. One of our campaign participants, Dr. Lena Liu, is currently a neurologist at Boston Medical Center and assistant professor of neurology at Boston University School of Medicine. But years ago, during the early stretch of her medical residency at a large teaching hospital, she found herself struggling with her own mental health. Fortunately, she got the professional help that she needed, and since then, she has been sharing her inspiring story in hopes of helping other healthcare professionals who may face their own mental health challenges. Unfortunately, Dr. Liu had a conflict and could not join us today, but I had the opportunity to chat with Lena about her journey and how it has shaped her own views on patient centered care, both as a medical professional and as a former patient. Here now is our conversation. Lena, I want to start by thanking you for taking the time to chat with me today. I know that you have some unique and powerful insights regarding patient centered care, and we very much appreciate your sharing those with us.
Of course. Thank you so much for having me.
Well, we're thrilled to have you with us. Let's dive into your journey through mental health challenges and recovery. You were a medical resident at a large teaching hospital when this journey began. What can you tell us about that time?
Yeah, it was a very demanding time in my life. I had just, started residency. I was getting used to the demanding schedule of being on 24-hour call, which was every fourth day. I was getting acquainted with a new hospital system, learning the new electronic medical record, and also even just being acquainted with logistical workflow issues.
So, what kinds of pressures were you feeling from all of that?
Honestly, at the beginning, I was feeling a lot of imposter syndrome, wondering if I belonged along with my peers, and finding myself comparing myself to my peers a lot more than I had prior to this.
Why did you feel that you might not belong?
There was a sense of whether or not I was able to be, in terms of merit, stacked up to the people that were next to me. And there was a lot of doubt internally about whether or not I was competent or if I was qualified enough to be in this position.
So, in terms of mental health challenges, how did they start emerging from those pressures and what you were feeling?
Yeah, I would say that the imposter syndrome, it quickly spiraled into a kind of generalized anxiety that I felt on a day-to-day basis. It was triggered and exacerbated by being at work. I had some physical manifestations of anxiety, including some chest tightness that I had never experienced before. I was also starting to feel a lot more isolated from my peers, afraid to open up really fully about what I was going through.
Well, let me ask you at this point, what was keeping you from opening up and being candid about what was going on? Was it stigma? Was it fear of the consequences of talking openly about your mental health challenges, such as they were? What was keeping you from being open about this?
For me, it was the fear of negative repercussions. As you mentioned, if I shared these things, would my colleagues look at me differently? What would happen to me? I had no idea what the consequences of sharing that would be, and it did cause me to be worried about that.
So you sort of pushed those feelings down. What did that feel like? What was the consequence of sort of isolating yourself around those feelings?
Pushing it down, actually just led it to become worse, I found, because as I was ignoring the issue, I was becoming more and more overwhelmed by things. And slowly, that amount of pressure and internal isolation just made me feel like I was paralyzed in a sense, like I couldn't really do what I wanted to do. I was very inefficient at even like writing patient notes. I was spending hours when honestly it could have taken me 30 minutes to complete a task. And so I really felt that my overall job performance was affected.
Can you put a finer point on that? Why was it taking you so long to do patient notes, for example? What was keeping you from getting that done more efficiently?
There was a lot of self-doubt in terms of what I was typing. I kept trying to double check everything I was typing and writing down in a patient chart. And for me, that really led me to spiral into a rabbit hole of like looking up specific things over and over again, and then just making sure that everything was right in the note.
Did you, at that point in time, have a sense that you might be dealing with clinical mental health challenges, or no?
I did realize the severity of what I was going through, but even still, I was afraid to go out and get some help.
You mentioned that there were some physical repercussions from all of this. What were those?
Right. So I definitely am a believer that your mental health can affect every aspect of your life, including physical health. For me, it was the anxiety that led to a lot of chest tightness, especially on the right side of my chest. I felt a lot of sometimes even shortness of breath as a manifestation of these things. And so it did translate.
So you were battling these challenges as you are a resident, and that can't be easy. Were you thinking about stepping up and seeking some care? Were you thinking about quitting the program? What was your thought process during this stage?
Yeah, another thing that I was experiencing because of all the anxiety was insomnia. So I had a lot of trouble falling asleep at nighttime. And when that became extreme, where it had been multiple days in a row without restful sleep, I knew that I should be asking for help. But there was kind of a turning point, I would say, when one of my mentors like noticed in me that something was wrong.
What did she notice?
So she was my mentor and my attending when I was on service. She could tell that I was fatigued from not having enough sleep, and she could tell that I was overthinking a lot of things. So she actually pulled me aside to have a private conversation.
So, we're talking today about patient centered care. That's our overarching theme for this course. I want you to sort of look back through that lens and share with us what this mentor was demonstrating in terms of patient centered care that proved to be so effectual for you.
So she was extremely empathetic. She put herself in my shoes and actually took me back to her residency days and was very vulnerable with me. So there was an open door for communication between us, which I felt was very like enlightening for me to see that even an attending at her level could be as open and candid with me. And in addition to those things, she was also extremely curious about what I was going through and let me share my own story with her in a very deep way that I hadn't shared with anyone else at that point in time.
So you were able to open up and share, as you just said there. What was the outcome of that conversation? What were the next steps that unfolded from there?
So she encouraged me to go seek help with a counselor at our employee assistance program, which I was initially hesitant to do so, but she actually made sure and physically walked me there so that she knew that I got connected with the care that I needed. And this was like a breakthrough in my mental health journey for sure.
Was that a scary step for you to take?
Honestly, it really was because I had never pictured myself as being the type of person that would need like an intervention as like of that sort. But when I did get the intervention that I needed, I felt like empowered.
And what happened next? You wound up in an intensive outpatient program, I believe.
Yes, so the employee assistance program, they were able to connect me with the McLean Outpatient Intensive Program, where I went for 2 weeks in order to get the help that I needed.
Tell us about that treatment process, what it looked like, what it felt like for you during those 2 weeks.
It was a very individualized experience. I had a lot of respect for how they ran the intensive outpatient program because they took into account each patient's needs and what their values were. And they were able to provide us with each a very unique schedule. For example, my schedule would not have been the same as one of my peers in the same program. It depended on what we needed in terms of psychotherapy and psychiatry sessions, and they tailored that to what each person needed.
Again, let's bring this back to that patient-centered care model. What stands out to you from that time? What worked? What might have been done differently?
I really think that they really had a good sense of collaborative decision making. So they took into account what I wanted from the experience, and they let me kind of have autonomy in a sense of guiding the clinical decision making process.
So during this stay, or this, you were coming and going. When we talk about intensive outpatient, you weren't actually staying at the facility. Is that correct?
Right, right. We would each come in every day.
Okay. So during this period, were you officially diagnosed?
I was, yes, I was given very specific diagnoses.
And
Yes.
can you share those with us?
Sure. I was diagnosed with generalized anxiety disorder. I was diagnosed with major depressive disorder, and I was diagnosed with obsessive compulsive disorder.
How did you process that news? For some people, a diagnosis can be very freeing. And other people, it can be very stigmatizing. It can be a combination of both. What did that look like for you internally when you heard those diagnoses?
At first, when I heard them, I was surprised because I was expecting to receive the diagnoses of generalized anxiety disorder and depression. But what was surprising to me was that I wasn't also expecting the diagnosis of OCD. But when my psychiatrist explained to me what her thought process was for the diagnosis, it made a lot of sense. So ultimately, the diagnoses ended up being really validating for me.
And from there, from McLean, you went back to your residency. Is that correct?
I did. I transitioned from the program back right into residency again.
What was that like? Was it a difficult reimmersion in the program itself, or did you come feeling armed with you had like you were armed with new tools?
I felt a little bit nervous about the transition because I was afraid to explain to my peers about why I had been absent from the program. But ultimately, no one that didn't come up. And so, what I learned from the intensive outpatient program did empower me to go back into the work field very like capable of dealing with my negative emotions.
Can you give us some examples or anything that comes to mind in terms of what felt different after that treatment process, the intensive outpatient treatment that you brought back to the hospital, back to your residency? Anything stand out for you that was different?
Yeah, I would say that in the program, we learned a lot about cognitive behavioral therapy and how CBT techniques can be used in order to calm negative thoughts. So when I was back on the floors in the hospital, when a self-doubt or self-esteem issue would creep up in my mind, I knew that it was a negative automatic thought, and I was able to combat it with the strategies that I had learned in the program.
I'm really curious, Lena, when you were at this stage, and again, still early in your residency, post-treatment or post or beginning of your treatment, um, were you already thinking at that stage about how you might incorporate some of what you had learned into your own practice someday?
It was a little bit like it was hard to process in the time being. So I would say it wasn't really until about 6 months or maybe 12 months after I had received the treatment that then I thought about giving back and thought about how I could incorporate the things that I had learned with my own patients.
And what did that look like? Because you actually stepped into advocacy during your residency.
Yeah, I actually found that I wanted to become kind of free from what I felt was, the burdens of my diagnoses, and I wanted to share what I was going through to make it seem more normal, just normalize it that physicians go through mental health struggles all the time. And so during my second year of residency, about a year after I had received treatment, I spoke on a mental health panel for the entire residency program. and opened up about details about my journey.
What was that process like, stepping into that role? Was that scary?
It honestly wasn't that scary, which was surprising for me. I felt like I could freely share things, and I just really wanted to give back to what had been given to me. And my peers actually ended up approaching me after the panel, and they commended me for how brave and courageous I was for sharing my story.
To digress for just a quick moment here, during that time when your residency, was it your sense that other peers were also struggling in a similar way that you were?
I felt like they were not. I felt like I was alone when I was going through it. But what ended up really surprising me and being eye-opening for me was that after I spoke on the panel, I had multiple of my friends and peers come up to me and tell me that they were going through almost exactly the same thing as what I was going through. And that the fact that I shared my story allowed them to approach me and tell me what they were going through as well.
And how did the rest of the residency play out for you, both personally in terms of your own challenges, and also about your advocacy in terms of what you were able to provide to others in your program?
Yeah, I was really happy with how the rest of my residency played out because I was able to use the skills that I had learned and then empower myself and overcome the struggles that I had at work. But in my fourth year of residency, I also formed own like mental health committee for the residency that I was in at the time. And I felt like I could create a panel every year. So I did, and became an annual mental health panel that hadn't existed yet in my neurology residency.
Wow, that's really cool. And fast forwarding from there, you've gone on to do some additional mental health outreach as well, including sharing your story through the Deconstructing Stigma program. Talk about the ongoing aspect of your advocacy, what it has felt like for you, and what you would like to continue to do.
Sure. So the Deconstructing Stigma campaign was a really unique and nice experience for me because I was able to share my story on a bigger platform. And I wanted patients, not only my own patients, but also providers to understand that what I had gone through is a normal experience. So being able to share that on the bigger platform was really gratifying for me. And in the future, this is why I'm doing the interview with you guys today. I just really want to be open about my experience because I'm hoping that by me sharing what I went through, it can help at least one more person.
Yeah, and that's so inspiring, that framework and that drive behind it. When you look back at where things were when you started your residency program and where things are today in the field itself, is it your sense that the field of medicine is doing a better job of addressing mental health challenges for folks going through training, or not necessarily?
I think that slowly things have been progressively getting better in the field in the last, especially 5 to 10 years. There is now a focus on wellness and on physician burnout. And so definitely there's more light on those topics, and those are coming to light a lot more. But what I think could still be worked on is also just addressing actual diagnoses like anxiety and depression, and those haven't really surfaced as much, which is why I want to be more open about it.
I want to zero in on some of the lessons learned from your journey, Lena. In terms of patient centered care, what lessons do you draw from your mental health care journey?
I think what I learned is the importance of the provider digging deeper to try to understand what a patient is trying to share. The importance of validating a patient's fears, a patient's concerns, what a patient sees as an obstacle for them, and then also emotional support and encouraging patients that this isn't how your life is going to be forever. There is a turning point for you, and that there are resources that can help you.
Let me drill down a little deeper on both of those fronts, or a couple of the points that you raised. The first being this notion that providers need to dig deep to understand what a patient is going through. Can you give me an example of what might be lost in translation, for example, if that's not the case?
Sure. So, for example, I would say that, for example, if a patient is telling you that they don't like taking medications at all, and you're trying to make a shared decision together, that really would influence how I listen to their story because I would be listening to how they go about their daily life, what do they do instead of medication, such as holistic approaches and things like that. That's a more comprehensive level of care.
Talk about the challenge of not bringing preconceived notions into a consultation. You are not a mental health care provider, but you are a healthcare provider. And I'm curious how you are applying some of these skills that we're talking about today in terms of patient-centered care with your own clients.
Yeah, so I try to have the goal of compassionate, active listening with every patient. There's a lot of, labels and diagnoses that come with opening up a patient's electronic chart. So I try not to generalize or stereotype based on the diagnoses that a patient already has, and try to listen to the story that they're trying to tell me in the moment.
Do you find that your colleagues, by and large, are facing these same sort of challenges and addressing them in similar ways? I mean, I guess what I'm trying to get at here is to what degree do you think the concept of patient-centered care is permeating the experience of those in your world as a medical professional?
I would say it really has come to fruition in the last few years. Like patient-centered care is what we all strive towards, and it makes a lot of sense in terms of collaborative decision making and compassionate listening as well.
What are some of the challenges to that being applied, that whole concept of patient-centered care? I mean, at a very practical level, time for a busy physician, for example. What sorts of things come up to mind for you for roadblocks to applying these principles?
Yeah, I would say that time is one of the biggest factors actually, because for new patient visits, sometimes you only get 40 minutes. For old patients, sometimes you only get 20 minutes, and it's hard to dig deep when that time isn't there. But then what I will try to do is facilitate a more quick follow-up to address other concerns and to see how the patient has done over time.
One of the components of patient-centered care that we're talking about today is language. And I'm wondering to what degree you have focused on that in your own practice and what comes to mind for you in terms of your own mental health journey, how language was critical one way or the other, positive or negative, in your experience of getting help as well.
I think that sometimes patients can experience things internally and not know how to voice them and how to articulate them out loud. So, having the tools and ability to communicate well is difficult. In addition to that, there's always the obstacle of, language barriers, patients who don't speak English. And there's also cultural differences that come up with that. And so a lot of times, the time of a visit will be doubled if you're using an interpreter, and that can come with its own challenges.
Anything else that comes to mind for you in terms of patient-centered care that we haven't touched on that you would like to share with other mental health or with other health providers who are with us today, or anybody else in terms of how these strategies can unfold?
Yeah, I would say definitely try to focus the most on making an individualized treatment plan for each patient that respects their values and what they find the most important in their lives, because for every person, it's not the same. So just being able to listen to the patient and know what would be the best course of action, not only for their disease, but for their own holistic health in general.
And when you talk about holistic health, be a little bit more specific for me in terms of what that might comprise.
Right. So a lot of times it could be, addressing with the patient stress management, how to go about sleep hygiene, referring them to external resources like physical therapy, occupational therapy, relaxation therapy. There's a lot of different ways to approach a single problem, and it doesn't always involve medications. So being able to have lifestyle modifications can be really helpful.
Just a couple more questions, and I'll let you get going here, Lena. But you had mentioned early on this notion of curiosity, and I'm wondering if you could talk a little bit more about that in terms of being an important component for any provider of medical services, whether physical health or mental health. What does that curiosity look like in practice?
I think it just means approaching each patient encounter with an open mind, not, being anchored down to one diagnosis from hearing the one-liner, for example, and being able to gather a comprehensive story and know how it's affecting the patient's life. So for me, I'm often curious about how mental health is affecting their physical health. So I often bring that up in conversation because stress can make a lot of things worse, including physical medical conditions too.
And let's bring this full circle here, Lena. We started by talking about your own journey during residency and how challenging that was for you to actually have to address what was going on in your life in terms of mental health challenges. Um, what do you want to say to somebody who might be viewing this video right now and is in a similar position? I imagine we have some folks in our audience today who are going through residency and in whatever the capacity that might look like for them and are feeling some of those same challenges that you were going through. What do you want to share with them?
I would really just try to emphasize to them that what you're going through, you're not alone. And I would really, really encourage them to go out and seek help because no matter how scary it seems to seek help, that's the first step in addressing the issue. And it could really, really change the course of your life and change how you approach stress and mental health struggles in the future. So the first step is to admit that you have a problem and then to seek the help that you need.
Lena, it has been such a pleasure chatting with you today, and I'm very inspired by the work that you're doing with your outreach. Thank you again for sharing all this with us. I know that your candor and commitment to improving patient-centered care are making a real difference, and we sure appreciate your time.
Of course, thank you so much for having me.
And again, that was Dr. Lena Liu, a participant in our Deconstructing Stigma Storytelling Initiative. We hope you found her story as inspiring as we do.